Good day, friends of Buzzy. Remember the good old days when we were making masks out of bras? We have actually done so much. You probably have seen our video on how not to freak out or faint with a flu shot. But today we're going to go a step further and talk a little bit about some of the myths that surround coronavirus, that surround this season's flu, and that surround mask wearing and all the things that happened, and then kind of go to what to do with coronavirus and fire and flood, because it's 2020. Let's start by talking about that original flu mask. So I'm Dr. Amy Baxter. I'm an emergency doctor, and a long time ago I said, hey, how about stopping transmission with a face mask made out of a bra? Bunches of people jumped on me. People were jumping on everybody about whether or not you actually need to wear a mask and whether we should wear masks, and even the Surgeon General said, don't wear masks. Okay, let's unpack a little bit of what happened and why there was misinformation. I think that the most likely thing is that when we were looking at coronavirus in March of 2020, we didn't know that it was respiratory primarily. We didn't know that there were aerosolized respiratory droplets, and we didn't know that it transmitted through the nose. So there were a lot of other public health things to focus on, like hand washing and distancing, and we didn't realize that mask wearing was as big a deal as it is now. Second thing was that I don't know if this is true or not, but the concept of saving the N95 masks for healthcare workers was a reasonable one. I would hate to think that anybody in the CDC would say masks don't protect you because they wanted to make people save them for healthcare workers, but it's possible. Nonetheless, I think much more likely is that the research that had been done up till that point was some of it was kind of fraudulent, some of it was ambivalent, and some of it was just not statistically evaluated correctly. But when you look at the research, masks help. We know that now. One other thing, though, about where the masks were and why we were so low on them has to do with natural disasters and climate change. Australia had had one of the worst wildfire systems in forever. The koala bears were going to be extinct. Everybody was talking about all of the wildfires in Australia, and they took China's entire supply of N95 face masks. Now, wildfires and face masks is actually one of the ways that we ended up getting masks where we needed them when coronavirus hit in New York. Turns out, in California, you are required to have a certain number of face masks per employee, and so Amazon had, Google had, lots of Silicon Valley companies, Facebook had masks that they could distribute other places because they'd been stockpiling them for California wildfires. So now we are at the place where we have wildfires in California again. We also have coronavirus going high in Louisiana and Texas, where we have hurricanes that are about to hit. So here are a couple ideas about what you can do if you are in the middle of a flood or fire zone. First of all, make a go kit. In your go kit, put magnesium, melatonin, zinc, the over-the-counter things that have been shown to increase your immune system and decrease severity. All of these have been retrospective, so they're not prospective controlled trials, but at this point, retrospective is better than nothing. Because you're going to be in close proximity, wear your mask, but also bring a nose clip, because if somebody is coughing and you can't get away, this way you can keep yourself from taking anything in through the nose. Yes, take some water. Yes, pack a couple bars of food, but also keep in mind that when you are in a shelter or if you have to leave, make sure you're someplace where there is an open flow of air. So if you can get a spot near an open window or a door, that's actually a much better place to decrease the incidence of respiratory droplets that might have coronavirus in them. And if you are in a place where you can say, just, hey, I know it's raining outside, but can we open the window? That is the move to make to protect yourself if you're in a natural disaster. Now let's talk about some of the flu misconceptions. I've been pushing for a long time, get your flu shot early. To reiterate, if you are 65 or older, September 15th, go out there and get it and try to get a high dose one. On our website, we've got lists of what the best vaccines are if you're older, because you want a higher strength vaccine. People older than 65, their antibodies and immune response can wane, so you want to make sure that you get it late enough that it will continue out into our usual end of flu season in March. Some people have been saying that the flu seasons that were in Brazil and Australia were so mild that they don't want to get a flu shot in the US this year because coronavirus is going to change the distribution of flu. I have two words to answer that proposition, that hypothesis, if you will. Boogers, children. In Australia, in Brazil, in places where they are currently having their flu season, it's totally true. They are not having much flu at all. And some of it's because 125% of the normal amount of flu vaccines were given. And some of it's because they're distancing, and some of it's because they're wearing masks. But the big difference between the US and these places is that they shut down schools. Children transmit flu. Children are fomites. Children are slimy little germ sponges, and they go to school, they share their little germ sponges with each other, and then they come home. Flu transmits and has an incubation period of about 1 to 2 days, meaning that as soon as you get exposed, you're getting sick. So it runs through like wildfire, as opposed to coronavirus, which is 5 to 7 days incubation, sometimes even 14. We have a very different scenario that is going to make flu a bigger issue in the United States. We have mandated education. We have mandated school attendance in some states. So all of those little snot sponges are going to be in class with each other sharing flu. So adults are going to get flu. They are definitely going to have a very different scenario than they have in Australia and Brazil. Other reason why flu is a big deal for coronavirus is because, sure, you're going to be in the emergency department with bad flu. Normally we have between 50 and 60,000 hospitalizations from flu every year, and depending on how you count it, between 20 and 50,000 deaths. With that said, you don't want to be in the emergency department getting evaluated for flu at the same time as everybody else is getting evaluated for coronavirus. It's going to overwhelm our emergency departments, but it also could expose you, and we don't know yet whether or not you're more or less likely, if you have flu, to get coronavirus. On that topic, there are actually 2 studies, one from Brazil and one in the US, that found that if a county had higher flu vaccination rates, their risk of having COVID ICU visits was down. So to be precise, again for people 65 and older, for every 10% increase in flu vaccination, 28% decrease in ICU rates. I think that it's part of the wacky, weird immune system response that we have to coronavirus. Whatever the reason though, having a flu vaccination in your community seems to decrease the likelihood of people at risk getting sick and being hospitalized. Final thing about flu and vaccination and coronavirus. So we are talking about herd immunity and whether or not there's cross-reactivity. There's some really interesting things about vaccination and immunity. For one thing, if you get the measles vaccine, you are much less likely to catch a whole bunch of other viruses over the next few years. Same thing with the BCG vaccine. For some reason, when your immune system learns about one virus, it seems to get smart about other viruses. Interesting thing, if you catch measles, it actually wipes out your immunity to a whole bunch of diseases you've got over the previous 2 or 3 years. So that's wild. The immune system is really complicated and funky. With flu, there are a couple different ways that a flu vaccine may influence your uptake and response to coronavirus. For one thing, there is a layer in the mucosa that is evolving and changing and releases something called IgA, which is a specific kind of immunoglobulin that you have on surfaces of things. The cool thing about snot is that this mucosal layer is actually very responsive to the immune system and to the things you've been exposed to. So it's quite possible that getting a flu vaccine could actually change the way your mucosal barrier reacts to coronavirus. One way this does it is that snot actually acts as a decoy. The snot that you have looks like a fake ACE2 receptor, so that when a virus comes in, it can actually be altered so that you don't have the virus hooking on to your ciliated epithelia where you catch coronavirus. Instead, it's on the snot and boogers, so you can flush it out, so you can blow it out, or of course you can wear this so you don't catch it in at all. But the flu vaccine may change the way our mucosal barrier reacts to coronavirus, and that itself could be helpful. So to summarize, if you're afraid of getting a flu vaccine, if you faint, if you pass out, we've got 5 easy steps and science in a video. If you're thinking about not getting the flu vaccine because it's not going to be a big deal in the States, you're just wrong. Think about, for example, think about the seasonality thing. So I early on was like, you know what? We're going to have a very seasonal response. Coronavirus transmission is going to go down in the summer. And the reason I thought this is because coronavirus absolutely transmits more in cold weather and when it's dry humidity, because it dries out your nasal passages, because it floats around longer on the breeze. And I was thinking, all right, so we got our 1918 flu. It went dormant in the summer. So this is going to behave the same way. Why didn't it? Because they didn't have air conditioning, and so there was always a free open window, and the virus got blown around so people didn't transmit it. In the United States, we've got air conditioning, so people stayed in small rooms when it got really hot and transmitted it to each other. So the way things work in the US, the way things work now compared to 1918 are different from other places in the world. Yes, coronavirus is going to spread more when it gets cold. Yes, if we're inside, we've got the rooms closed, it's going to be a problem. If you can go out and eat in an outdoor restaurant now, do it now while it's still warm enough to be out there. But don't feel secure in not getting a flu shot because other countries have had it better. We've got kids in school, we're going to be transmitting. So get your flu shot. Pack a bag in case you're in a place where there is a risk of forest fire or a risk of flood. And don't hesitate, if you're in a situation where you are not sure about safety, to ask someone to open a window, ask them to wear a mask, ask for fans to be turned on if possible, and if all else fails, don't be afraid to look a little bit like a dork. It's going to be fine.